Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants bare understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Imagine waking up after a weekend in the hospital to 3 different phone messages. Your primary care doctor says stop drug A. The specialist says continue drug A, but reduce the dose. The pharmacist calls and says drug A interacts with a new antibiotic you were prescribed in the ER, and you need a different script now. 2 weeks later, your symptoms worsen. There's a preventable complication, and nobody has a single shared plan. This is not a rare story. It's a safety problem that affects outcomes, costs, and stress levels for patients and families. Today, we're going to cut through that chaos. In the next 20 minutes, you'll be able to do 3 concrete things. Build a simple team map so everyone's role is clear, create a 1-page health summary that clinicians will actually read, and start a communication plan that reduces conflicting orders. This is general educational information, not personalized medical advice, but these are practical steps you can implement right away to make your care safer and easier to manage. Section 1. Who's on your team and what they should be doing. Start with the obvious. Your primary care provider. That's the clinician who manages overall health, coordinates referrals, and usually knows the broad picture of your conditions. Specialists, cardiologists, endocrinologists, neurologists, focus on a specific organ or disease and should handle specialty-specific decisions. Nurses and nurse practitioners provide ongoing care, help interpret instructions, and often are the most reachable team members. Pharmacists are medication experts. They can identify interactions, suggest alternatives, and should be consulted whenever drug changes happen. Therapists, physical, occupational, speech, manage function and rehabilitation. Finally, care managers or case managers help navigate appointments, insurance authorizations, and can be your advocate inside a health system. Each role has realistic limits. The PCP coordinates, specialists treat specialty problems, pharmacists manage meds, and case managers handle logistics. When those roles are clear, accountability and outcomes improve. When should you add a specialist? If a problem needs focused expertise, unexplained worsening symptoms, an abnormal test that affects care decisions, or a condition not improving despite treatment, it's time. Before you accept a referral, ask 3 quick questions. What specifically will this specialist manage? How will they communicate back to the PCP? And what outcomes or tests should I expect and when? If those answers are vague, request clarification or ask for a case manager to coordinate the referral. Vetting a specialist doesn't mean checking online ratings only. It means understanding the role they'll play in your plan and how they'll share information. Section 2. Practical coordination tools you can start today. Number 1. The 1-page health summary. On a single page, include current diagnoses, allergies, key surgeries or hospitalizations with dates, and your primary problem right now in 1 sentence. Follow that with current medications in a table. Drug name, dose, frequency, and reason. Add contact info, PCP, key specialists, pharmacy, and emergency contact. Clinicians love brevity. This document lets them scan and act quickly. Number 2, the unified medication list. Keep it updated after every visit or new prescription. When in doubt, call your pharmacy and ask for a printed medication profile. Pharmacists often have the most accurate list. Number 3, the visit checklist. Before appointments, bring your 1-page summary, medication list, 1 or 2 prioritized questions, and any symptoms or changes since the last visit. A good script: my main concern today is X. I tried A and B. I need to know whether you recommend C or D, and how quickly I should expect improvement. Clear, focused, and time-bound questions get clearer answers. Section 3. Communication scripts, escalation, and red flags. How to call or message. Lead with the outcome you want. Example phone opener. Hi, this is Pat Jones. My PCP is Dr. Smith. I was seen in the ER for chest pain on May 4 and sent home with medications. My question is whether I should continue drug X while waiting for cardiology follow-up. I'd like a clarification in writing. Attach your one-page summary or say where it's stored. If you need a faster response, request a care conference where the PCP, relevant specialist, and pharmacist join a brief call to align plans. Clinicians can coordinate if you ask for a joint conversation. It isn't automatic.
Know the red flags that mean escalation is needed. Worsening symptoms despite treatment, new dangerous interactions on your medication list, missed test results that change care, or contradictory written instructions. If you see those, call your PCP and say, "This is urgent because X is getting worse. I need either an expedited appointment, a same-day phone evaluation, or a documented plan within 48 hours. If you hit roadblocks, request a case manager or patient advocate from the health system. For insurance or authorization issues, document the dates of calls and the names of representatives. It helps when you need faster approvals or a prior authorization recheck."
Recap and 3 simple takeaways you can do this week. 1. Create your one-page health summary and keep it in your phone or wallet. 2. Update and print a unified medication list from your pharmacy profile and bring it to every visit. 3. Use the communication script. State your desired outcome, attach the one-page summary, and ask for a documented plan or care conference when instructions conflict. Quick templates, the one-sentence current problem, a medication table, and the phone opener I shared. Copy them, tweak them, and use them. These small steps reduce errors and reduce stress. Before we wrap up, a reminder that this episode is general education and not a substitute for clinical advice. If you're managing complex or unstable conditions, please contact your clinicians directly or request a case manager through your health system. For templates and downloadable one-page summary and scripts, visit facbynursejessicaconsulting.com/resources. I've put ready-to-print versions there so you can start immediately. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at FAQbynursejessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.